Dry eye is a common problem here in Arizona, so let's talk a little bit about what are the treatment options for dry eye. First of all, symptoms of dry eye usually is watery eye, actually. Interestingly, you have good tears and you have bad tears, and if you don't have enough good tears, then you'll start producing a lot of bad tears and start overwatering, and these are not as healthy or as comfortable for the eyes. The first step, of course, in dry eye treatment is artificial tears, and there are some artificial tear brands that are better than others. We like to recommend right now the Systane Ultra or the Systane Balance lens. You can get those over the counter, or I'm sorry, artificial tears. You can get those over the counter, and those are the ones I get the best feedback from patients with. The second step, if artificial tears are not enough and you're still having problems with dry eye, is to consider plugs in the eyes. Now, what are plugs? Well, we have these canals that go from our eyes to our nose, and every time you blink, you pump tears down into your nose. If we can keep those tears on the eyes a little longer, then you'll have less symptoms of dry eye. So we put a tiny little plug in the opening of the canal, and it prevents tears from going down into the nose, and very much, I'd say 85% of the time, people feel a great improvement in their dry eye symptoms. If artificial tears and plugs are not sufficient, then the next step I usually go with is the prescription of Restasis eye drops. Restasis is a twice-a-day drop that over a year's period of time will improve your tear production and your tear quality. And some patients have found great help with that. The next step after that is really humidity, and a lot of times people have to move away from the desert because of their dry. Not a lot of times, but rarely. Sometimes a person has to, it's so severe that they have to move away. There are some things that enhance dry eye, of course dehydration, but there are some medications, a lot of allergy medications can dry out the eyes, and then there are some conditions, rheumatological conditions, and one called Sjogren's syndrome where you have dry eye and dry mouth, all mucous membranes are dry. But here at Sonoran Desert Eye Center, those are the steps that we usually take to treat dry eye, starting with artificial tears and then working our way up. Some other things you might consider doing: flaxseed oil, supplements, omega-3 fatty acids, and those kind of things can be helpful to some degree. So if you have any questions about dry eye, please don't hesitate to contact me at kevinq@sonorandeserteye.com.